Tumors can come in all shapes and sizes. For people living with them, life can be an emotional struggle. But many make the most of their condition and persevere. Sometimes this affliction is barely noticeable, which is why it's important to know when a tumor can be life-threatening. How can you tell if a tumor is cancerous? What causes them to form?
Let's find out.
This is Your Body On, Living with Tumors. Getting diagnosed with a tumor can be terrifying news, but not all tumors are created equally. A tumor is a group of abnormal cells that form lumps or growths. They can be benign, premalignant, or malignant. We'll explore each distinction in detail to help you understand when a tumor might be cancerous. As the leading cause of death worldwide, cancer took almost 10 million lives in 2020. So what is the difference between a tumor and cancer? And how are tumors treated? Benign tumors. The discovery of a lump that can be felt outside the body can be scary. It's easy to think you might have cancer. But take a deep breath. Chances are that any tumor you have will be benign. They are very common. 9 out of 10 women show benign breast tissue changes throughout their lives. Unlike malignant tumors, benign tumors stay in one place and don't spread. They usually have a regular and smooth shape and can be easily removed. Once they're taken out, they likely will not return. Although they're not cancerous, benign tumors can cause pain or other medical complications if not treated. This can happen if it becomes large and causes pressure on nearby body parts. For example, a benign lung tumor can compress the trachea, making it harder to breathe. Premalignant tumors. Also known as precancerous, premalignant tumors gradually grow more abnormal until they become cancer. Having a premalignant tumor doesn't mean you're automatically going to get cancer, but your chances are certainly a lot higher. It may disappear on its own, but it can definitely develop into cancer if it goes untreated. The good news is that treatment will usually solve the problem. Common non-cancerous tumors include fibroids and cysts. Up to 80% of women will develop fibroids in their uterus by 50 years of age, and at least 30% of adults over 50 will suffer from polyps in the colon. Even if your tumor does become cancerous, starting treatment as early as possible will help your fight against it. Malignant tumors. If your tumor grows into nearby tissues and has cells that break away, it is a malignant tumor. This means it is cancer. The breakaway cells can travel through your blood or lymphatic system and spread to other parts of your body.
Everywhere.
Early detection is the key to the successful treatment of your cancer. Almost 85% of all cancer cases are carcinomas, making it the most common type of cancer. These tumors form in epithelial tissues that line all of your organs and body cavities and produce your skin. In 2020, lung cancer was the leading cause of death among cancer patients. The carcinogens in secondhand smoke can increase your chances of cancer, among other factors. Everything from your genetics, exposure to radiation, and even viruses can increase the risk of cancer. Brain tumors. Brain tumors can be benign or malignant. In children, they often form near the cerebellum. These are known as primary tumors. In adults, they are more likely to start in another part of the body and then spread to the brain. You may suffer from unexplained nausea, confusion, and a change in the frequency of headaches. As the tumor progresses, you might have a gradual loss of sensation in your arms and legs. You could also have trouble seeing or speaking. About 700,000 Americans are living with primary brain tumors. Of those, about 71% are benign. It is estimated that nearly 89,000 Americans will be diagnosed with a primary brain tumor in 2022. The average age for a primary brain tumor diagnosis is 61, but you have a 3 in 4 chance of survival. Treatment. Any treatment you receive will depend on the type of cancer you have, the severity of the cancer, and your present health. It could involve chemotherapy, radiation, or hormonal treatment to reduce the size of the tumor. Surgery might also be a possibility to remove the tumor. With new developments in cancer research, medical science has helped save millions of lives around the world. Maybe someday we'll find a cure, but that's for another episode. Now that you've survived your tumor, what would happen if you had worms in your brain? We'll wiggle into that on another episode of Your Body On.